Sarah Martinez had always been different. While other kids played with dolls or video games, she bandaged her stuffed animals and pretended to be a doctor. Her parents thought it was just a phase, but Sarah knew from the age of 6 that she wanted to help people who were hurt. Growing up in a small town in Texas, Sarah didn't have much money. Her father worked at a gas station, and her mother cleaned houses to make ends meet. But they always supported Sarah's dream. When she graduated high school with top grades, they helped her apply for scholarships to nursing school. Sarah worked 3 jobs while studying nursing. She cleaned offices at night, served coffee in the morning, and studied between classes. It was hard, but she never gave up. Her professors noticed how dedicated she was. While other students complained about the long hours and difficult patients, Sarah always stayed calm and focused. After graduating, Sarah applied to work at military hospitals. She wanted to help soldiers who risked their lives for their country. Many people told her it would be too hard, too dangerous, too stressful. They said a small-town girl like her wouldn't survive in such a tough environment. Sarah proved them wrong. She got a job at Fort Campbell Army Base in Kentucky as a trauma nurse. The base was huge, with thousands of soldiers training every day. The hospital was always busy with injuries from training accidents, routine medical care, and sometimes real combat wounds from soldiers returning from overseas missions. On her first day, Sarah walked into the emergency ward wearing her crisp white uniform. She had spent extra money to buy the best stethoscope she could afford and kept her nursing supplies perfectly organized. Some of the other nurses looked at her and smiled, but not in a friendly way. "Look at the new girl," whispered Janet, a nurse who had worked there for 10 years. "All shiny and new. Let's see how long she lasts when things get really tough." Mark, one of the male nurses, laughed. "She looks like she's never seen blood before. This isn't some quiet town hospital where the worst injury is a scraped knee." Sarah heard their comments but didn't respond. She had learned long ago that the best way to handle doubters was to show them through her actions, not her words. She focused on learning everything she could about the base hospital's procedures and getting to know the soldiers who came in for treatment. The first few weeks were challenging. Sarah had to learn new computer systems, different medical protocols, and how to work with military doctors who were used to giving orders quickly and expecting immediate responses. Some of the doctors were impatient with her questions, and a few of the experienced nurses made her job harder by not sharing important information. But Sarah was determined. She stayed late to practice procedures, studied medical journals at home, and always volunteered for the most difficult shifts. When other nurses called in sick, Sarah was ready to cover for them. When there was a medical emergency in the middle of the night, Sarah was the first one to respond. Despite her hard work, many people at the base still didn't take her seriously. During staff meetings, some doctors would ignore her suggestions. When she tried to share ideas for improving patient care, other nurses would roll their eyes. A few of the senior staff members still called her the new girl even after she had been working there for 6 months. The situation got worse when Sarah started working with combat veterans. These were soldiers who had been injured in real battles overseas and needed specialized care. Many of them had been through terrible experiences and didn't trust easily. Some had post-traumatic stress disorder and could become angry or scared without warning. Other nurses often avoided these patients because they could be difficult to work with. But Sarah spent extra time with them. She learned their names, asked about their families, and listened when they wanted to talk about their experiences. She never judged them or made them feel like their emotions were wrong. One veteran named Tommy had lost his leg in an explosion in Afghanistan. He was angry all the time and refused to do his physical therapy. The other nurses dreaded working with him because he would yell and sometimes throw things when he got frustrated. Sarah worked with Tommy differently. Instead of trying to force him to do exercises, she sat with him and let him talk about his anger. She brought him coffee the way he liked it and never rushed him during treatments. Slowly, Tommy began to trust her. He started doing his exercises when Sarah was working and even smiled sometimes when she told him funny stories about her hometown. The other nurses noticed how well Sarah worked with difficult patients, but, instead of respecting her skills, they became more jealous. Janet started spreading rumors that Sarah was just trying to get attention from the doctors. Mark told people that Sarah was too soft and would never be able to handle a real emergency. "She's all talk and no action," Janet said during a break one day. "When something really serious happens, she'll probably faint or run away crying." Sarah knew what people were saying about her, but she didn't let it affect her work. She continued to focus on her patients and improving her skills. She took extra training courses on trauma care, learned new medical procedures, and even studied basic military tactics so she could better understand what soldiers went through in combat. The base commander, Colonel Williams, had started to notice Sarah's work. He received reports from doctors about which nurses were performing well, and Sarah's name came up often in positive reviews. Patients specifically requested to work with her, and the hospital's patient satisfaction scores improved when she was on duty. But Sarah's colleagues still didn't know about the recognition she was receiving from higher-ups. To them, she was still just the small-town nurse who didn't belong in their elite military hospital. The tension came to a head during a particularly busy night shift. 3 soldiers had been injured during a training exercise, and the emergency room was chaotic. Sarah was assigned to work with the most seriously injured soldier, a young man named David who had severe burns on his arms and chest. David was in terrible pain and scared. The burns were serious enough that he might need to be transferred to a specialized burn unit at another hospital. Sarah worked quickly and calmly, cleaning his wounds, starting 4 medications for pain, and monitoring his vital signs constantly. Janet was working with one of the other injured soldiers nearby. She kept looking over at Sarah with a critical expression, waiting for her to make a mistake. When Sarah asked for help lifting David to change his position, Janet pretended not to hear her. "Can someone help me turn this patient?" Sarah called out loudly. Mark walked over slowly, as if he was doing Sarah a big favor. "Maybe you should have asked for an easier assignment," he said sarcastically. "This guy is pretty messed up. Sure you can handle it?" Sarah ignored the comment and focused on helping David. She noticed that his breathing was becoming more labored, and his blood pressure was dropping. These were signs that he might be going into shock, a life-threatening condition that required immediate treatment. "Dr. Morrison, I need you to look at bed 3 right away," Sarah called out to the attending physician. "Patient is showing signs of shock." Dr. Morrison was busy with another patient and waved her off. "Give him more fluids and pain medication. I'll be there in a few minutes." But Sarah knew that a few minutes might be too long. She had studied shock extensively and recognized that David's condition was deteriorating rapidly. She made a quick decision to start emergency protocols without waiting for the doctor's direct order. She increased David's 4 fluid rate, elevated his legs to improve blood circulation, and called for additional medical equipment. Other nurses watched her work, some shaking their heads disapprovingly at her initiative. "She thinks she's a doctor now," Janet muttered to Mark. "Someone should report her for overstepping her authority." But Sarah's quick thinking saved David's life. When Dr. Morrison finally got to examine him, the patient's condition had stabilized thanks to Sarah's immediate actions. The doctor realized how serious the situation had been and praised Sarah for her excellent clinical judgment. "Good catch, Martinez," Dr. Morrison said quietly. "You probably saved this kid's life tonight." Despite the doctor's praise, the other nurses continued to criticize Sarah. They said she had been lucky, that she had acted inappropriately, and that next time she might not be so fortunate. Some even complained to the head nurse that Sarah was being reckless and needed better supervision. Sarah felt discouraged but didn't give up. She knew she was a good nurse, even if her colleagues didn't recognize it. She continued to work hard, take care of her patients, and improve her skills. She also started preparing for advanced certifications in trauma nursing and emergency medicine. What Sarah didn't know was that her reputation was growing beyond the base hospital. Military medical personnel from other hospitals had heard about the dedicated nurse at Fort Campbell who could handle any situation and had a special talent for working with traumatized soldiers. Word was spreading through military medical networks that there was someone exceptional working at the base. Colonel Williams had also been keeping track of Sarah's performance. He had received multiple reports from doctors praising her clinical skills, and several soldiers had written letters specifically mentioning how much Sarah had helped them during their recovery. The colonel was impressed by Sarah's dedication and professionalism. One evening, as Sarah was finishing her shift, she overheard Janet and Mark talking near the nurses' station. "I heard they're looking for volunteers for some special medical training program," Janet said. "Of course, they'll probably pick people with more experience, not someone who's been here less than a year." Mark nodded. "Yeah, they need nurses who can handle real pressure situations. Not someone who just got lucky once with a burn patient." Sarah didn't ask about the special program. She had learned that trying to insert herself into conversations with her colleagues usually led to more criticism and dismissive comments. Instead, she focused on finishing her patient reports and preparing for the next shift. But the conversation made her think about her future. She loved working with soldiers and wanted to do more to help them. Maybe there were opportunities she didn't know about, ways she could use her skills to make an even bigger difference. She decided to research advanced military medical programs and see if there were ways to get involved in more specialized care. What Sarah didn't realize was that her name was already being considered for something much bigger than a training program. Her exceptional work had been noticed by people far above the level of the base hospital. Military medical commanders were looking for nurses with special skills and dedication to work in the most challenging and dangerous situations. The stage was being set for Sarah to prove herself in ways she had never imagined. All the criticism, all the doubts, all the challenges she had faced were about to lead to an opportunity that would change everything. But, first, she would have to face the biggest test of her career, one that would finally show everyone exactly what kind of nurse she really was. 2 weeks after the conversation Sarah had overheard, everything changed during what started as an ordinary Tuesday morning shift. Sarah arrived at the hospital at 6 in the morning, just like always. She checked the patient roster, reviewed overnight reports from the previous shift, and began her usual rounds. The morning was unusually quiet. Most of the patients were stable, and there were no emergency admissions during the night. Sarah used the calm time to catch up on paperwork and prepare medical supplies for the day ahead. She had learned that quiet moments at a military hospital were rare and should never be wasted. Around 10 o'clock, the peaceful atmosphere was shattered by the sound of helicopter rotors approaching the base. Sarah looked out the window and saw 2 military helicopters landing on the hospital's emergency pad. This wasn't completely unusual, but something about the urgent way the aircraft approached made her pay closer attention. Within minutes, the emergency department doors burst open. Military medics rushed in carrying stretchers with injured soldiers. Sarah could see immediately that these weren't training injuries. The wounds were severe, and the soldiers were covered in dirt and blood from real combat. "We have multiple casualties from a special operations mission," shouted the lead medic as they wheeled the first patient into the trauma bay. "3 critical, 2 stable. We need all available medical personnel right now." Sarah dropped what she was doing and rushed to help. She had trained for situations like this, but this was her first real mass casualty event since starting work at the base. Her heart was racing, but she forced herself to stay calm and focused. The first patient was a soldier who had been hit by an explosion. He had severe injuries to his chest and abdomen, and was barely conscious. Sarah immediately began checking his vital signs while Dr. Morrison and the surgical team prepared for emergency surgery. Janet and Mark were working on other patients, and Sarah noticed they both looked nervous and overwhelmed. This was clearly more serious than anything they had dealt with recently. The emergency room filled with tension as medical staff rushed to save lives. "Martinez, I need you to assist with the chest tube insertion," Dr. Morrison called out as he worked on the most critically injured soldier. Sarah had practiced this procedure many times, but never in such a high-pressure situation. She gathered the necessary supplies and positioned herself to help the doctor. Her hands were steady, and she anticipated exactly what equipment Dr. Morrison would need before he even asked for it. While they worked, Sarah noticed something concerning about the patient's breathing. The chest tube wasn't draining properly, which could mean internal complications that weren't immediately obvious. She quietly mentioned her observation to Dr. Morrison, who quickly checked her concerns and found that she was correct. "Good eye, Martinez," the doctor said as he made adjustments to the treatment. That could have been missed until it was too late. The surgery on the first patient took 3 hours. During that time, Sarah never left the operating room. She anticipated every need, handed over instruments before being asked, and monitored the patient's condition constantly. When the patient's blood pressure dropped suddenly, Sarah had already prepared the emergency medications that Dr. Morrison needed. By the end of the surgery, the patient was stable and would survive. Dr. Morrison looked exhausted but relieved. He pulled Sarah aside as they left the operating room. "That was exceptional work in there," he told her. "I've worked with combat nurses for 15 years, and I've rarely seen someone handle that level of pressure so well. Where did you learn to anticipate medical needs like that?" Sarah was tired but felt proud of her performance. "I just tried to think ahead and stay focused on what the patient needed," she replied. "I've been studying trauma procedures and practicing whenever I could." But, while Sarah had been in surgery, something else had been happening in the hospital. Word had spread quickly through the medical staff about how well the new nurse had performed during the emergency. Some people were impressed, but others, particularly Janet and Mark, felt threatened by the attention Sarah was receiving. During her break that afternoon, Sarah overheard Janet talking to a group of nurses in the break room. "Everyone's making such a big deal about Martinez helping with one surgery," Janet said dismissively. "Any experienced nurse could have done the same thing. She just happened to be in the right place at the right time." Mark nodded in agreement. Plus, Dr. Morrison was doing all the real work. She was just handing him instruments. It's not like she actually saved anyone's life. Sarah felt hurt by their comments, but she was getting used to this kind of criticism. No matter how well she performed, some people would always find reasons to diminish her achievements. She decided to focus on her patients rather than worry about what her colleagues thought. What Sarah didn't know was that Dr. Morrison had filed a detailed report about her performance during the emergency surgery. Military hospitals keep careful records of how medical staff perform during critical situations, and Sarah's file was starting to show a pattern of excellence under pressure. Colonel Williams received Dr. Morrison's report along with several others praising Sarah's work. The colonel was beginning to realize that the young nurse might be exactly the kind of person the military needed for special assignments. He decided to keep a closer eye on her performance and see if she was ready for bigger challenges. A few days later, Sarah was assigned to work with a new patient who had just arrived at the base. Staff Sergeant Mike Rodriguez had been seriously injured during a covert mission overseas. He had multiple gunshot wounds, severe burns, and was suffering from post-traumatic stress disorder. He had already been treated at 2 other military hospitals, but his condition wasn't improving. The problem wasn't just medical. Rodriguez refused to cooperate with most of the medical staff. He didn't trust doctors or nurses, and he became violent when people tried to examine his wounds or give him medication. Previous hospitals had recommended sedating him heavily, but that approach was preventing his injuries from healing properly. "Good luck with that one," Janet said when Sarah was assigned to Rodriguez's care. 3 nurses have already asked to be transferred away from him." He threw a water pitcher at the last one. Sarah read Rodriguez's medical file carefully before entering his room. She learned that he had been on special operations missions for 8 years and had seen some of the worst combat situations imaginable. His injuries were from a mission where most of his team had been killed, and he was struggling with survivor's guilt on top of his physical pain. When Sarah walked into Rodriguez's room, he looked at her suspiciously. He was a big man with scars covering his arms and face. His eyes were hard and angry, and he tensed up when she approached his bed. "Let me guess," Rodriguez said in a rough voice. "You're here to poke and prod me some more, ask me how I'm feeling, and then write notes about how crazy I am." Sarah pulled up a chair and sat down near his bed, but not close enough to make him feel trapped. "Actually, I'm here to listen if you want to talk, and to help you feel more comfortable. But I'm not going to force you to do anything you don't want to do." Rodriguez stared at her for a long moment. He was used to medical staff trying to control him, give him orders, or treat him like he was just another problem to solve. Sarah's approach was different, and he wasn't sure what to make of it. "You don't look old enough to be a real nurse," he said, testing her reaction. "How long have you been doing this job?" "A few weeks?" Sarah smiled calmly. "Almost a year. And, you're right, I am young. But, I've been studying trauma care and working with combat veterans since I started here. I know your injuries are serious, and I know you've been through things that most people can't imagine." Something in Sarah's voice made Rodriguez relax slightly. She wasn't talking down to him or trying to pretend she understood exactly what he had been through. She was just being honest and respectful. Over the next few days, Sarah worked patiently with Rodriguez. She never pushed him to talk about his experiences, but she was always available when he wanted to share something. She brought him coffee the way he liked it, helped him contact his family, and made sure his room was quiet when he needed to rest. Most importantly, Sarah helped Rodriguez with his medical care in a way that gave him some control. Instead of forcing him to take medications at specific times, she explained what each medicine was for and let him decide when he felt ready to take it. Instead of changing his bandages according to a rigid schedule, she worked with him to find times when he felt less anxious. The other nurses watched Sarah work with Rodriguez and couldn't believe how well she was managing a patient they had all given up on. Within a week, Rodriguez was cooperating with his treatment plan, and his wounds were finally starting to heal properly. "I don't understand how she does it," Mark said to Janet as they watched Sarah help Rodriguez with his physical therapy. "He was ready to attack anyone who came near him, and now he's actually doing his exercises." Janet was irritated by Sarah's success but tried not to show it. "She's probably just got him fooled temporarily. Wait until he has a bad day and snaps again. Then, we'll see how good she really is." But Rodriguez never snapped at Sarah. In fact, he started asking specifically for her when he needed medical care. Other patients noticed how calm and comfortable Rodriguez seemed when Sarah was working with him, and they began requesting her care as well. Dr. Morrison and the other doctors were amazed by the transformation in Rodriguez and several other difficult patients who had started working well with Sarah. They began assigning her to the most challenging cases, knowing that she had a special ability to connect with traumatized soldiers. Colonel Williams was receiving regular updates about Sarah's exceptional work with difficult patients. He had also heard about her performance during the emergency surgery from multiple sources. The colonel was beginning to think that Sarah might be ready for a very special opportunity. Unknown to Sarah, military medical commanders had been looking for nurses with specific qualifications for a classified assignment. They needed someone with excellent trauma care skills, the ability to work under extreme pressure, and a special talent for gaining the trust of elite soldiers who had trust issues. The assignment was dangerous and would require someone who could handle both medical emergencies and psychological challenges in high-stress environments. Most experienced military nurses weren't interested in such risky work, and those who were interested often lacked the right combination of technical skills and emotional intelligence. Sarah's file was starting to look exactly like what the commanders were searching for. Her performance reviews were exceptional, her patients consistently requested her care, and she had proven she could handle emergencies calmly and effectively. But there was one more test. Before Sarah could be considered for the special assignment, she would need to prove herself in a situation that would push her skills to the absolute limit. The opportunity for that test was about to arrive in a way that nobody expected. Late one evening, as Sarah was finishing her shift, alarms started going off throughout the base. Emergency lights flashed, and loudspeakers announced that all medical personnel should report to their stations immediately. Something big was happening, and Sarah was about to face the biggest challenge of her career. She had no idea that the events of the next few hours would change everything about how people saw her, and would lead to an opportunity that she had never imagined possible. All the criticism, all the doubts, and all the hard work were about to pay off in a way that would shock everyone who had underestimated her abilities. The emergency alarms continued blaring as Sarah rushed back to the hospital. She could see other medical staff running toward the building, and military vehicles were speeding across the base. Something serious was happening, but nobody seemed to know exactly what. When Sarah reached the emergency department, she found chaos unlike anything she had seen before. Dr. Morrison was shouting orders to nurses and technicians, while Colonel Williams stood near the communication center talking rapidly into a radio. "Martinez, get over here, Dr." Morrison called out when he spotted Sarah. "We have a situation developing. There's been an incident during a special operations training exercise in the mountains. We're expecting multiple casualties, but that's not the worst part." Sarah hurried over to Dr. Morrison, her mind already switching into emergency mode. She had learned to stay calm during crisis situations, but something about the tension in the room told her this was different from anything they had handled before. "What's the worst part?" Sarah asked as she began checking emergency equipment. Dr. Morrison's face was grim. "The exercise site is in a remote mountain area about 2 hours away by ground transport. The terrain is too dangerous for regular helicopters to land safely, especially in the dark. But we've got soldiers who need immediate medical attention, or they're not going to make it." Sarah felt her stomach drop. She understood the problem immediately. If injured soldiers were stuck in a location that was too dangerous for normal medical evacuation, their chances of survival dropped dramatically with each passing hour. "How many casualties are we expecting?" Sarah asked as she began preparing medical supplies. "Unknown," Dr. Morrison replied. "Communication with the training site has been spotty. We know there was an explosion during a night exercise involving special forces units. At least 6 soldiers are injured, possibly more. Some of the injuries are described as critical." As if on cue, Colonel Williams approached their conversation. The colonel looked more serious than Sarah had ever seen him. "Dr. Morrison, I need to speak with you privately. And bring Nurse Martinez with you." Sarah was surprised to be included in whatever private conversation the colonel wanted to have. She followed Dr. Morrison and Colonel Williams into a small conference room near the emergency department. Colonel Williams closed the door and turned to face them both. "What I'm about to tell you is classified information. The training exercise that went wrong tonight wasn't just any exercise. It was a test run for a highly sensitive special operations mission that's scheduled to take place next week." Sarah listened carefully, unsure why she was being told such sensitive information. The colonel continued. "The soldiers who were injured are part of an elite unit that has been preparing for this mission for 6 months. These aren't regular infantry soldiers. They're special forces operators with years of specialized training. The military has invested millions of dollars and months of preparation in this mission." Dr. Morrison nodded grimly. "And if we can't get them the medical care they need, the mission will have to be cancelled or delayed significantly." "Exactly," Colonel Williams said. "But here's the bigger problem. We've received intelligence that suggests we may have only a narrow window of opportunity to complete this mission. If we delay much longer, the strategic advantage will be lost, and American lives could be at risk in the future." Sarah was beginning to understand why this situation was so critical, but she still didn't understand why she specifically had been asked to join this conversation. Colonel Williams looked directly at Sarah. "Nurse Martinez, I've been reviewing your performance records since you started working here. Your clinical skills are exceptional, you work well under pressure, and you have a special talent for gaining the trust of combat veterans. These qualities make you uniquely qualified for what I'm about to ask." Sarah felt her heart rate increase. Whatever the colonel was about to propose, it was clearly going to be dangerous and challenging. "There is a way to reach the injured soldiers tonight," Colonel Williams continued. "We have access to a specialized military helicopter that can land in the difficult terrain where the accident occurred. But the flight will be extremely dangerous, the landing area is barely large enough for the aircraft, and the medical personnel who go on this mission will be working in primitive conditions with limited equipment." Dr. Morrison looked concerned. "Colonel, you're talking about sending medical personnel into a combat-style environment. That's not something we typically ask of hospital staff." "I understand the risks," Colonel Williams replied. "That's why I'm asking for volunteers, and why I want someone with exceptional skills." Nurse Martinez, would you be willing to participate in this medical evacuation mission? Sarah felt a mix of fear and excitement. This was exactly the kind of challenging situation she had always wanted to be prepared for. All her extra training, all her studying of emergency procedures, had been leading up to moments like this. What exactly would be involved? Sarah asked. Colonel Williams spread out a map on the conference table. The helicopter can carry a small medical team to the accident site. You would need to stabilize the injured soldiers for transport, possibly perform emergency medical procedures in the field, and then care for them during the flight back to the base. Sarah studied the map. The accident site was marked in a mountainous area that looked remote and difficult to reach. She could see why regular aircraft couldn't land there safely. How long would we have at the site? Sarah asked. The helicopter can't stay on the ground for long because of the terrain and weather conditions, the colonel replied. You would probably have 30 minutes, maybe 45 at most, to assess all the patients and prepare them for evacuation. Dr. Morrison shook his head. That's not much time to stabilize multiple critical patients. You're talking about battlefield medicine, not hospital care. Sarah had studied battlefield medicine as part of her trauma training, but she had never practiced it in real conditions. The thought was intimidating, but also exciting. This was the kind of challenge that could prove whether all her preparation had been worthwhile. I'll do it, Sarah said without hesitation. Colonel Williams looked pleased but not surprised. I hoped you would say that. But I want you to understand that this mission involves real risks. The helicopter flight will be dangerous, the working conditions will be primitive, and you'll be responsible for making life-or-death medical decisions with limited resources. Sarah nodded. I understand. When do we leave? The helicopter team is preparing now. You'll have 30 minutes to gather emergency medical supplies and brief with the flight crew. Dr. Morrison, I need you to help her select the right equipment for field medicine. As they left the conference room, Sarah noticed that other medical staff were watching them with curiosity. Word was already spreading that something unusual was happening, but most people didn't know the details. Janet approached Sarah as she was gathering medical supplies. What's going on? I heard the colonel was asking for volunteers for something dangerous. Sarah continued packing emergency medications and equipment. There's been an accident during a training exercise. Some soldiers need medical evacuation. And they asked you to help? Janet's tone was skeptical. Shouldn't they be sending someone with more experience for something that important? Mark joined the conversation. I heard they're using a special helicopter for this mission. That sounds pretty risky. Are you sure you're qualified for whatever they're asking you to do? Sarah paused in her packing and looked at both Janet and Mark. For almost a year, they had questioned her abilities, criticized her methods, and suggested that she wasn't ready for challenging situations. Now, when the hospital's leadership had specifically chosen her for the most difficult mission they had ever attempted, they were still expressing doubts. The colonel and Dr. Morrison believe I'm qualified, Sarah replied calmly. That's what matters right now. Sarah finished gathering her supplies and headed toward the helicopter landing area. As she walked through the hospital, she passed Rodriguez, the Special Forces soldier she had been working with. He was out of bed and walking around as part of his recovery. Hey, Martinez, Rodriguez called out when he saw her. I heard something big is happening tonight. You be careful out there, whatever you're doing. Sarah smiled at him. Thanks, Rodriguez. Keep doing your exercises while I'm gone. Rodriguez grinned. You got it. And, Martinez? Whatever they asked you to do, you're gonna do great. You're tougher than you look. Sarah appreciated the encouragement from Rodriguez more than he probably realized. After months of dealing with colleagues who doubted her abilities, it felt good to have support from someone who understood what it meant to face dangerous situations. The helicopter was waiting on the landing pad when Sarah arrived. It was unlike any aircraft she had seen before. The helicopter was painted in dark colors, had specialized equipment mounted on the sides, and looked designed for military operations rather than medical transport. The pilot, Captain Jake Mitchell, greeted Sarah as she approached the aircraft. "You must be the nurse we're taking into the mountains tonight. I have to tell you, this is going to be a challenging flight. The weather isn't great, and the landing zone is pretty tight." Sarah loaded her medical supplies into the helicopter. "I'm ready for whatever we need to do." Captain Mitchell looked impressed by her confidence. "Good. We're also taking Sergeant Lewis, our flight medic. He's got combat medical experience, so you'll have help when we reach the accident site." Sergeant Lewis was a quiet man in his 30s who had clearly been in dangerous situations before. He helped Sarah secure her equipment and briefed her on what to expect during the flight. "The injured soldiers have been in that location for almost 3 hours now," Sergeant Lewis explained as they prepared for takeoff. "Their buddies have been giving them basic first aid, but we don't know how serious their conditions have become." Sarah felt the familiar calm that came over her during medical emergencies. Despite the dangerous flight ahead and the challenging conditions they would face, she was ready to do whatever was necessary to help the injured soldiers. As the helicopter lifted off from the base, Sarah looked down at the hospital where she had worked for the past year. Janet and Mark were probably still questioning whether she was qualified for this mission. By tomorrow morning, they would have their answer. The flight into the mountains was everything Captain Mitchell had warned it would be. The helicopter shook violently in the wind, and Sarah could see very little through the windows except darkness and occasional glimpses of rocky terrain below. But she used the flight time to organize her medical supplies and mentally prepare for the challenges ahead. After what felt like an eternity, Captain Mitchell's voice came through the headset. "We're approaching the accident site. I can see lights down there, which means the soldiers are conscious and organized." "That's a good sign." Sarah looked out the window and saw a small area illuminated by flashlights and emergency flares. She could make out several figures moving around what appeared to be injured soldiers lying on the ground. This was it. In a few minutes, she would face the biggest test of her medical career. The helicopter landed with a hard bump on the rocky mountain terrain. Through the wind and noise, Sarah could see soldiers running toward the aircraft with flashlights. Even before the rotors stopped spinning, she was grabbing her medical supplies and preparing to jump out. The scene that greeted Sarah was unlike anything she had experienced before. 6 soldiers lay scattered across a small clearing, some unconscious, others moaning in pain. The explosion had happened near a practice bunker, and debris was scattered everywhere. The uninjured soldiers had done their best to provide first aid, but their supplies were limited. Sergeant First Class Mike Thompson, the unit leader, approached Sarah as soon as she stepped off the helicopter. His face was covered in dirt and sweat, and his voice was hoarse from shouting orders. "Thank God you're here," Thompson said urgently. "We've got 6 men down. 2 are critical, 3 are serious, and 1 is stable but still needs medical attention." Sarah immediately went into emergency mode. She had practiced triage procedures many times, but never in such primitive conditions. Using her flashlight, she quickly moved from patient to patient, assessing their injuries and deciding who needed the most immediate attention. The first critical patient was a soldier named Davis who had severe chest injuries from the explosion. He was having trouble breathing, and Sarah could see that he needed immediate intervention or he wouldn't survive the helicopter ride back to the base. Working with Sergeant Lewis, Sarah quickly set up her emergency equipment. The ground was rocky and uneven, making it difficult to work, but she managed to insert a chest tube to help Davis breathe. Her hands were steady despite the challenging conditions, and she completed the procedure successfully. "How did you learn to do that so smoothly in field conditions?" Sergeant Lewis asked as they worked. "That was textbook technique, even out here." Sarah was focused on monitoring Davis's vital signs. "I practiced emergency procedures whenever I had spare time at the hospital. I wanted to be ready for situations exactly like this." While Sarah worked on Davis, she was also coordinating the care of the other injured soldiers. She directed the uninjured soldiers to help with patient positioning, sent Sergeant Lewis to work on the second critical patient, and kept track of everyone's condition simultaneously. The second critical patient was a soldier named Williams who had severe burns on his arms and legs. Sarah had extensive experience treating burn patients from her work at the base hospital, but treating burns in a mountain clearing with limited supplies was a completely different challenge. Working quickly but carefully, Sarah cleaned Williams's wounds and applied specialized burn dressings she had brought in her medical kit. She also started in 4-line to provide fluid replacement, which was critical for burn patients. "Where did you get these burn supplies?" Williams asked weakly as Sarah worked on his injuries. "This stuff is way better than the basic first aid kit we carry." Sarah smiled reassuringly. "I made sure to pack everything we might need before we left the base. I've worked with a lot of burn patients, so I know what works best." As Sarah worked, she noticed that the uninjured soldiers were watching her with amazement. These were elite Special Forces operators who had seen combat and were used to working with military medics. But Sarah's level of skill and preparation was clearly impressing them. Thompson pulled Sergeant Lewis aside while Sarah continued working. "That nurse is incredible," Thompson said quietly. "I've worked with combat medics for 15 years, and I've never seen anyone handle this kind of situation so calmly and professionally." Sergeant Lewis nodded in agreement. "She came more prepared than most field hospitals I've seen. And she's making medical decisions that show real experience and intelligence." After 30 minutes of intensive work, Sarah had stabilized all 6 patients for helicopter transport. The 2 critical patients were conscious and stable, the 3 serious patients were comfortable and properly treated, and even the stable patient had received thorough care for his injuries. Captain Mitchell approached Sarah as they prepared to load patients onto the helicopter. "We need to get moving. The weather is getting worse, and I want to get everyone back to the base safely." Loading 6 injured soldiers onto the helicopter was a complex process, but Sarah had planned for this challenge. She had arranged her medical equipment so she could monitor all the patients during the flight, and she had prepared medications for any complications that might arise. During the flight back to the base, Sarah worked continuously to keep all 6 patients stable. She adjusted 4 medications, monitored breathing, checked wound dressings, and reassured the conscious patients that they were going to be okay. One of the soldiers, a young man named Parker, looked up at Sarah during the flight. "Ma'am, I just want to say thank you. When that explosion happened, I thought I was going to die out there. You saved my life tonight." Sarah squeezed Parker's hand gently. "You're going to be fine. We'll have you back at the hospital in a few minutes, and the doctors there will take excellent care of you." When the helicopter landed at Fort Campbell, Dr. Morrison and a full medical team were waiting. As the patients were transferred into the hospital, Dr. Morrison could see immediately that Sarah had done exceptional work. All 6 soldiers were stable, properly treated, and ready for continued care. "Martinez, what you accomplished out there tonight was remarkable," Dr. Morrison said as they walked into the hospital. "You basically ran a field hospital in the mountains for 30 minutes, and all your patients are going to make full recoveries." Word of Sarah's successful mission spread quickly through the hospital. Within an hour, everyone knew that the young nurse who had been criticized and doubted had just completed one of the most challenging medical evacuations in the base's history. Janet and Mark heard the details from other staff members and couldn't believe what they were learning. The nurse they had dismissed as inexperienced and unprepared had just proven herself capable of handling situations that would challenge even the most experienced military medical personnel. Colonel Williams arrived at the hospital early the next morning to check on the injured soldiers and debrief with the medical team. He found Sarah finishing her patient reports after working through the entire night. "Nurse Martinez, I want to thank you personally for your exceptional service last night," the colonel said. "Thanks to your skills and dedication, 6 soldiers are alive and will recover fully from their injuries." Sarah felt exhausted but proud of what they had accomplished. "Thank you, sir. I was just doing my job." "No," Colonel Williams replied firmly. "What you did last night went far beyond your regular job. You performed field medicine at the level of a combat veteran, and you did it while maintaining the highest standards of patient care." The colonel paused and looked at Sarah seriously. Which brings me to why I wanted to speak with you this morning. Your performance last night confirmed what I had already begun to suspect based on your work here at the base. You have exactly the skills and character that the military needs for very special assignments. Sarah was intrigued but cautious. What kind of special assignments? The Army is forming a new unit of medical professionals who can work with Special Forces teams in the most challenging environments around the world, Colonel Williams explained. These are missions where regular military medics don't have sufficient training, and where hospital-based medical personnel usually can't adapt to field conditions. Sarah felt her heart rate increase. This sounded like exactly the kind of challenging work she had always wanted to do. The colonel continued. The pay is significantly higher than regular nursing positions, the training is extensive and specialized, and you would work directly with the most elite soldiers in the military. But the assignments are dangerous, often classified, and require someone who can handle extreme stress while maintaining perfect medical standards. It sounds incredible, Sarah said honestly. But why are you offering this to me? There must be nurses with more experience who would be interested. Colonel Williams smiled. We've been looking for the right candidates for 6 months. Most experienced military nurses are too set in their ways to adapt to field conditions. Most civilian nurses don't understand military culture well enough to work with Special Forces teams. You're the first person we've found who has the perfect combination of medical skills, adaptability, and character. Sarah thought about everything that had led to this moment. All the criticism from Janet and Mark, all the extra studying she had done, all the difficult patients she had worked with, and all the challenges she had faced had been preparing her for this opportunity. When would I start? Sarah asked. If you accept, you would begin specialized training next month, the colonel replied. The first assignment would be in 3 months, working with a Special Forces unit on a classified mission overseas. Before Sarah could respond, the hospital intercom announced that she had visitors in the main lobby. Sarah was surprised, since she wasn't expecting anyone to visit her at work. When Sarah reached the lobby, she found all 6 soldiers from the mountain rescue mission waiting for her. They were in clean uniforms, and their injuries were bandaged but healing well. Thompson stepped forward as their spokesman. Nurse Martinez, we wanted to thank you properly for what you did for us, Thompson said formally. We've all served in combat, and we've worked with many medical personnel over the years. What you did last night was the best field medicine any of us have ever seen. Davis, the soldier with chest injuries, was on crutches but looked healthy. Ma'am, I want you to know that my family heard about what you did. My wife and kids asked me to personally thank the nurse who saved my life. Williams, who had the burns, held up his bandaged arms. The doctor said I'm going to heal completely with no permanent damage because of how well you treated my burns in the field. I owe you everything. Sarah felt overwhelmed by their gratitude. These were tough, experienced soldiers who had seen real combat, and they were thanking her like she was a hero. Parker, the youngest soldier, spoke up. Ma'am, we heard that you might be joining Special Forces medical units. If that's true, we want you to know that any team would be lucky to have you. You're the best combat medic any of us have ever worked with. As the soldiers filed out of the lobby, Sarah noticed that other hospital staff had gathered to watch the scene. Janet and Mark stood near the nurses' station, looking stunned by what they had witnessed. Dr. Morrison approached Sarah with a smile. I think it's safe to say that you've proven yourself beyond any doubt. I've never seen combat veterans show that level of respect for a medical professional. Sarah looked around the lobby and saw that everyone was looking at her with new respect. The doubts, the criticism, and the skepticism were gone. She had proven herself in the most challenging situation possible, and everyone knew it. Colonel Williams rejoined the conversation. Nurse Martinez, have you made a decision about the special assignment I offered? Sarah looked around one more time at the hospital where she had worked so hard to prove herself. Then, she thought about the opportunity to use her skills in the most challenging and important situations possible. Yes, sir, Sarah said with confidence. I accept. 6 months later, Sarah was working with special forces teams around the world, providing medical support in situations that most people couldn't imagine. She had become one of the most sought-after combat medics in the military, and her reputation had spread throughout special operations communities. But she never forgot the base where it all started, or the colleagues who had doubted her abilities. Sometimes the best way to answer criticism is simply to prove what you're capable of when given the chance. Janet and Mark still worked at Fort Campbell, and they often told new nurses the story of Sarah Martinez, the small-town nurse who had become a legend in military medical circles. They always ended the story the same way: we should have recognized her talent from the beginning, but sometimes it takes extraordinary circumstances to reveal extraordinary people. The last anyone heard, Sarah was leading a specialized medical team that worked exclusively with the most elite military units in the world. She had found her calling, and she was saving lives in ways that few people ever get the chance to do. And it all started because she never stopped believing in herself, even when everyone else doubted what she could accomplish.